All right. Again, good evening, everybody. Hopefully everybody can hear me all right. If you cannot, please let me know. You can unmute yourselves and speak up or type something into the chat box if possible. Thank you for joining us tonight. For Medicare 101 Part 3, tonight we're going to be talking about Medicare Part D, the prescription drug benefit of Medicare. I will pause during the presentation at different intervals to see if anybody has any questions. If you do have a question when I pause for them, you are welcome again to unmute yourself and simply ask your question, or you can type your question into the chat box at any time and I will address them at those pauses. So let's go ahead and get started. Again, I am with the Pikes Peak Area Agency on Aging, which is an organization that is here to help establish policies and procedures in coordination with other community partners to develop systems and programs that help people stay in the community and in their homes for as long as possible. And it serves 3 counties of Colorado: Park, El Paso, and Teller. I am also the SHIP coordinator, the State Health Insurance Assistance Program coordinator for our area. The SHIP program is a federally funded program that's specifically designed to provide in-depth one-on-one counseling and education with unbiased information and assistance. We do not endorse any specific insurance products or companies, and we can help educate people on any and all parts of Medicare and all things related to Medicare. The SHIP program is in El Paso County, actually covers 9 counties of Colorado. There is a SHIP program available to everybody. So there's a SHIP program available in every county of every state in the country, available at the very least by a toll-free statewide number. I've provided our Colorado state toll-free number as well as our local Colorado Springs number for the 9 counties that we serve. I also wanted to mention tonight that at the end of the presentation, or when you get a follow-up email sometime tomorrow, there will be a survey included in that email. This is part of a national survey that is being administered by the Administration for Community Living, which is the federal entity that runs the SHIP and SMP programs for the country. These survey results are directly related to the funding for these programs. So I would encourage you and ask you to take the survey when you get the follow-up email. It will be an email link embedded in your follow-up email that will also provide you a link to a recording of this presentation. Funding for this program is vitally important, considering that we provide this service at no cost to the consumer. And so any feedback that you can provide to the Administration for Community Living is greatly appreciated. Quick review of the topics we've already covered in parts 1 and parts 2 of our series this month. Part 1, we covered Medicare A and B, eligibility and enrollment. For week 2 or part 2, we covered Medigap or Medicare supplements and Medicare Advantage plans, eligibility and enrollment. And of course, tonight we are going to cover Medicare Part D, the prescription drug benefit of Medicare. So what is Medicare Part D? It is the prescription drug benefit of Medicare. It covers only outpatient prescription medications, meaning it only covers prescriptions that you get from your doctor, you take to the pharmacy, and you pick up at the pharmacy. This is a relatively new benefit of Medicare. It went into effect in 2006. Prior to that, Medicare did not provide prescription coverage in any way, shape, or form. As part of how the prescription drug benefit of Medicare works, there are many different plans available to choose from in each state. And each one of those plans will include a list of covered medications, also known as a formulary. And it must include a specific range of drugs in all categories of medications. For Part D plans, you typically will pay a monthly premium. And you may have copays and deductibles to pay as well. Financial assistance is available for Part D costs for people who have limited or low income and resources. And we will talk about all of these in more detail as we go. So as always, the first question we're going to ask is, should you enroll in Medicare Part D? And as with all other parts of Medicare, Part D is optional. It is not a required benefit to enroll in. In order to be eligible to enroll in Medicare Part D, you must be enrolled in Medicare Part A or Medicare Part B or both. You do not have to be enrolled in both A and B to be eligible to enroll in a Part D benefit. You can, there are certain situations where you may not have to enroll or need to enroll in a Medicare Part D, and that would be if you are already covered by what would be considered credible drug coverage. And that would be credible, meaning it's as good as or better than what Medicare offers through a Part D benefit. Examples of credible drug coverage would be any drug coverage basically you have through active employment and with employer group health benefits. Credible drug coverage is also considered through the VA. So if you access all of your pharmacy benefits through the VA, that is considered credible drug coverage. If you have other credible drug coverage, you can delay enrollment into Medicare Part D without penalty if you should need to enroll in the future. And you would want to consider different aspects of whether or not to enroll in Part D when you first become eligible, or if you want to enroll down the road. Things to take into consideration is how much you're paying currently for your prescriptions and the health insurance that provides it versus how much you would pay for a Part D plan in premiums and copays. Again, enrolling in a Medicare Part D is optional. You can delay enrollment into Part D if you have other credible drug coverage. But if you simply don't see the need to enroll in Part D because you don't take any medications at this time, again, Medicare Part D is an optional benefit. You're not required to enroll in it. But if for some reason you were to need to enroll in a Part D in the future, you would probably have to pay some form of late enrollment penalty unless you had other credible drug coverage in the meantime. So if you simply choose not to enroll in a Part D now, or when you first become eligible for Medicare and enrolled in Medicare, simply because you don't take any medications, if you need to enroll in the future, you will likely pay a penalty for not having drug coverage sooner. As with all things related to Medicare, there are enrollment periods that you need to be aware of. Again, to enroll in a Part D, you only have to be enrolled in A or B or both. Initial enrollment for Part D will be the same initial enrollment period to enroll in Medicare A or B or both. And that is going to be the 7-month window, the 3 months prior to, the month of, and the 3 months after the month of your 65th birthday or month of eligibility. That would be your initial enrollment period also into a Medicare Part D. Then there's the annual election period, also known typically as open enrollment. That's the enrollment period that happens every year in the fall, October 15th through December 7th each year, where you can get into a Part D or Advantage plan, switch from one Part D or Advantage plan to another, or drop a Part D or Medicare Advantage plan during that time frame, and whatever change you decide to make during that time frame would be effective for January 1st. And then, of course, there are special enrollment periods. Special enrollment period, again, is typically going to involve loss of other credible coverage. So, for example, if you delay enrollment in Part D now because you are actively employed with employer group health coverage, that includes a drug benefit. If you were to lose that employer drug coverage or health benefit that included drug coverage when you retire or stop working, that would create a special enrollment period based on the loss of that coverage. Special enrollment periods for Part D typically are only 63 days from the date of the loss of other coverage. Again, waiting to enroll could mean a penalty unless you have other credible drug coverage. If you were to incur a penalty on Part D enrollment, that penalty is calculated slightly differently than for the penalty, say, for Medicare Part B as in boy. Penalty for Part D is calculated on a monthly basis, and it's calculated by adding 1% per month for every full month you were eligible to enroll in a Part D, but did not enroll, nor did you have other credible drug coverage. That penalty does accumulate over time. When you enroll in a Part D, if you have a penalty assessed to that cost, they are going to calculate from the time you could have enrolled, your initial enrollment period, but did not, to the time you do enroll. They're going to add up all those months in between. Then they're going to multiply that amount of months by whatever the national average benchmark or monthly premium is across the country. For 2021, that national average monthly premium for Part D plans across the country, $33.06. So if you waited 12 months to enroll in a Part D, you didn't have other credible drug coverage in place of, that penalty would be 12% multiplied by $33.06. Whatever that amount came out to would be tacked on to whatever premium you pay for Part D plan when you enroll. As with all Medicare penalties, once you incur them, they are for life. So it's not a one-time penalty. It's not a temporary penalty. That penalty amount will be tacked on to the monthly premium of whatever plan you enroll in every month for the rest of your life. However, if you qualify for assistance, financial assistance on Part D costs based on limited or low income, Part D penalties are waived in those situations. Also, as with Medicare Part B as in boy, Medicare Part D as in drug premiums can be affected by income, meaning the higher income you have, the higher Part D premium you may have to pay. Income limits are the same as they are for Medicare Part B, but the higher amounts that you may have to pay based on that higher income are going to be lower because premiums for Part D tend to be lower. This chart here shows those income limits and income levels. The higher annual income you have, the higher Part D premium you will have to pay. And it shows the amounts for 2021 that would be tacked on to the premium of whatever Part D plan you might enroll in. Again, the way this higher amount or this income related monthly adjustment is calculated is by Social Security, and it's calculated based on the most recent complete income tax filing they can access, meaning the information that they are going to use to determine whether or not you may have to pay a higher Part D premium will probably be based on old information, what your income was 2 years ago, for example, because that will be the most complete income tax filing that they can access. If you get a notice from Social Security that indicates that you may have to pay a higher Part D premium based on higher income, but in the meantime, you have retired and your income is not at that level anymore, again, you can appeal that decision by Social Security and indicate to them that your income is no longer at that level so that you are required to pay that higher amount if your income is not still at that high level. Otherwise, there is no base premium for Part D. Part D premiums vary from plan to plan and range anywhere from as low as, in 2021, premiums range as little as $7.30 per month to as high as well over $100 per month, depending on the plan. And there are a total of 27 plans to choose from in Colorado. Any questions about any of that so far? Again, if you have a question, go ahead.
So I have a question. Since para covers drugs, if you drop your para and want to go back, do you have guaranteed coverage without a penalty for Part D like you do for supplements?
So because para is a retiree benefit, And that retiree benefit does include what's considered credible drug coverage in all of their plan options. To drop the para and look at other private options available to you, you would be able to enroll in a Part D without penalty because the para coverage is considered credible.
Okay, so at any point that you drop para, you would have that option.
Correct.
Great, thank you.
You're welcome. Any other questions? Okay. All right, so what does Part D cover and how does it work? So basically, Medicare Part D is designed based on a general outline of coverage. This is the basic outline of coverage that Medicare has created. And this is the minimal amount of coverage that any provider who offers a Part D benefit to any consumer, this is the minimum level of coverage that they must provide to you. That minimal level of coverage states that there will be a deductible each year. For 2021, that deductible is $445. What that means is if you enroll in a plan with a deductible, once you're enrolled in the plan, the first time you go to the pharmacy to use that plan, you may have to pay full price for any medications that you pick up. That full price amount will be applied towards that deductible and will continue to be applied to that deductible until you spend a total of $445 at the pharmacy. Once you've reached that deductible amount, the next time you go to the pharmacy to pick up a refill, your cost at the pharmacy should be much lower in the form of a copay. So once the deductible is met, Medicare says that your copay amount is a maximum of 25% of the retail cost of that medication. So again, while you're meeting deductible, you're paying full retail price. Once you've met your deductible, your cost of the pharmacy is at most 25% of that retail price. You will continue to pay 25% of that retail price maximum as your copay at the pharmacy until you hit a certain dollar amount. So while you're at the pharmacy paying your deductible, full retail price of the drug, while you're at the pharmacy paying only 25% of the cost of that drug as a copay, what the plan and Medicare are doing is they're taking the full retail cost of every medication you purchase and they're adding it up in the column over here where you can't necessarily see. So every time you pick up a medication, they're taking the full retail price and adding it up in this column. Once the numbers or the costs in this column add up to a total of $4,130 within the calendar year, you will have reached what they call the donut hole or the coverage gap in your Part D benefit. When you hit the coverage gap or the donut hole, your costs may change. In 2020, the federal government, quote unquote, closed the donut hole. What that means is the cost in the donut hole will always stay at the cost it is now, which would be 25% of the retail cost for brand name drugs and generic drugs. And you may be sitting there thinking, well, isn't that what I was paying in copays after the deductible? And the answer is yes. However, what you need to remember is this is the most basic outline of coverage that is offered by any Part D plan. And most plans, probably 99% of all the plans, provide better coverage than this basic outline. What I mean by that is, for example, you may have a plan that has a deductible, but it may also have zero copay generics after you've met your deductible. Or it may have zero copay generics that they don't apply to deductible, so you don't have to meet the deductible as long as you have a zero copay generic from their formulary. You will continue to pay that zero copay generic copay at the pharmacy, which is no copay at all, until the retail cost. So even though you're paying a zero copay at the pharmacy, they're still taking the retail cost of that generic medication and adding it up in this column, going towards that $4,130 limit. If you hit that limit and you hit that coverage gap, that zero copay generic medication that you've not been paying anything for will suddenly start costing you 25% of retail. So basically that's where you're going to see a difference if you hit the coverage gap in your Part D benefit within a calendar year. If you hit that coverage gap, the plan will continue to add some of the cost of your medications to this column over here. So once you hit that $4,100 or $4,130 limit, again, you're going to start paying 25% of the retail cost for all your medications. And Medicare and the plan are only going to continue to add that 25% cost to this column over here. So to get you to that coverage gap, they were adding the full retail price of all the medications you were purchasing. Once you get to the donut hole or coverage gap, they're only going to continue to add the 25% cost that you're actually paying at the pharmacy. To get to the other side of that donut hole or coverage gap, you would have to spend, or your drug cost would have to total in retail cost a maximum of $10,048.39 this year. So it takes, unfortunately, much, much longer to reach the other side of the coverage gap than it takes to get there. If somehow you were to manage to reach the other side of the coverage gap in your benefit before the end of the calendar year, you would run into the catastrophic coverage level of the benefit. If you reach catastrophic coverage level, then your costs at the pharmacy go down again, much more significantly, and you only start paying 5% of the retail cost as your copay, or $3.70 copay for generic, $9.20 maximum copay for brand name drugs. Once the end of the year comes along and a new year begins, this cycle starts all over. So once you've, all of this happens within a calendar year, and then it starts all over come January 1st. Where again, you may have to meet another deductible and so on and so forth. Again, this is the least amount of coverage that any Part D benefit can offer you through any Part D plan. And most plans right now provide, excuse me, provide better coverage than this. So as part of that coverage requirement, Medicare does require any and all companies that offer Part D plans. Medicare requires them to cover at least 2 medications in every class of medication available out there. So, for example, if there are 20 different kinds of medications available in the class that treats high cholesterol, Part D plans are only required to offer 2 of those 20 on their formulary or list of covered drugs. But they have to offer at least 2 of those drugs in every class of medication available. And there are some classes of medication where they have to offer all drugs that are available on the market. Those special classes of medication, there are 6 of them, include the antidepressants and antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics. Any drug that's on the market under those 6 categories must be covered by all Part D plans, period. But all other medical classes of medication plans only have to cover 2 out of however many are available on the market. Does that mean that they will only cover 2? Not necessarily. What that does mean, though, is that each plan will choose which 2 or more that they will cover. So not all plans may cover the same medications. The list of medications that a plan covers, again, is referred to as a formulary. And we're going to talk about more of that more in just a second. For Medicare Part D to cover a prescription medication, there are some additional requirements. Medicare Part D plans only cover medications that are available by prescription, meaning a doctor has to write a prescription in order for it to be covered by Medicare Part D, and it has to be prescribed for its medically intended purpose and approved by the FDA. When I say it has to be prescribed for its medically intended purpose, what that means is, for example, these days, a lot of doctors may be prescribing Viagra for high blood pressure. Viagra was not created with the intention of treating high blood pressure. So if it's being prescribed to treat high blood pressure, it's being prescribed for something that was not its medically intended purpose and would not be covered. Viagra is not covered anyways, but that's the best example I can give off the top of my head. All plans must cover all drugs, including biologicals and insulins, and the supplies for injecting insulins, including the syringes, needles, gauze, etc. And all plans must include brand name and generic drugs on their formulary. However, I can guarantee you that if you are currently taking a brand name medication and suddenly halfway through the year, that medication is suddenly available as a generic. Their patent has run out. Now it can be sold as a generic medication. That brand name drug that the plan has been paying for you to be on, that plan would be allowed to, with notice, tell you that they will only now cover the generic drug instead of the brand name drug, unless the doctor can justify your need for the brand name drug. There are some drugs that would not be covered under Medicare Part D, and that would include any medications that are already covered under Medicare Part A or Medicare Part B. Drugs covered under Medicare Part A would be any medications you receive while you're inpatient in a hospital or a skilled facility. Drugs covered under Medicare Part B would be drugs that you must receive in a medical setting, such as chemotherapy treatments, dialysis treatments, some infusions for osteoporosis, stuff like that. If it's a medication that must be administered in a medical setting or a doctor's office, that drug will be covered under Medicare Part B as in boy. All other medications that require a prescription, again, Part D covers the drugs that you get the prescription from the doctor, you take it to the pharmacy gives you the prescription. That is what Part D covers. Doesn't cover over-the-counter medications. In other words, medications that do not require a prescription. Even if it does require a prescription, if it's specifically used to treat anorexia or for fertility purposes or for cosmetic purposes only, Medicare Part D will not cover it. Even if it requires a prescription, if it's specifically prescribed to treat and relieve cough and cold symptoms, guaifenesin or Robitussin is a perfect example. Medicare Part D does not cover it. And most vitamin supplements and mineral supplements are not going to be covered by Part D either. Some exceptions to that rule if there are vitamins or minerals being prescribed to treat very specific medical conditions. Any questions about any of that? So the bottom line is every plan will be able to choose what drugs it wants to cover out of all of the categories and all the drugs available in each category. And that means that each drug plan will have a different list of drugs that they cover. So it becomes very, very important to make sure that whatever Part D plans you may be looking at cover your very specific drug needs. Because it does you no good to enroll in a plan because it has a low premium, but it doesn't cover half of your medications. So something to keep in mind, and we'll talk about ways to find out what plans cover what drugs in the next few minutes here. So again, any questions about any of this so far? No? All right. Again, there is financial assistance available on Part D costs for people who have limited or low incomes. Financial assistance on Part D specifically is available through Social Security. So you apply for this assistance through Social Security. If you are already on any other kind of assistance program, such as SSI, Supplemental Security Income, Medicaid, or are eligible and enrolled in the Medicare Savings Program, you will automatically become eligible and enrolled in the financial assistance for Part D, also known as low-income subsidy or extra help. There are different levels of assistance available depending on income and assets. Again, you apply for this assistance through Social Security. You can either go to the Social Security website, you can call Social Security directly at their 800 number, or of course, you can contact us, your local SHIP office, and we do help people with these applications. Applications for the financial assistance for Part D are actually very quick and easy to complete, and they can be done over the phone, even if you call the SHIP office for that assistance. The 2021 income and asset limits shown on this slide. These numbers are based on monthly income in gross dollars, meaning pre-deduction dollars for both a single person and a couple. These are the high limits. These are the high-end maximum amounts that you can have and still qualify for assistance. The lower income and asset levels that you have, the better the assistance is that you may qualify for, meaning the lower cost you will have out of pocket to have a Part D with this assistance. Again, we are happy to help people if they want more information about these programs or to see if you're eligible or for assistance in applying for them. If you are eligible and become approved for extra help for Part D, the best benefit of it is it eliminates the donut hole, meaning your costs do not change if you hit the donut hole in your coverage, and it significantly reduces your copays at the pharmacy, and typically will also eliminate deductibles for Part D benefits. So it can save lots and lots of money, even if you get less help because you're at that higher end of that income limit scale. Any assistance that you qualify for eliminates the donut hole and can save tons and tons of money. So again, please contact us if you have additional questions or want more information. If for some reason you do not qualify for the financial assistance through Social Security, but you do still take some very expensive brand name medications, there may still be some assistance available to you. That assistance would come directly from the manufacturer of the medications and is typically going to be applicable, again, to those newer, more expensive brand name medications. Basically, if you are seeing a commercial on TV for a medication, it's going to be really, really expensive these days. But you can still apply for patient assistance with most companies, even if you are enrolled in a Medicare Part D, because these companies do realize that once you hit that donut hole, even at 25% of the retail cost, sometimes that can still be pretty unaffordable for some of these medications. I've listed some of the websites that we use to help people look up patient assistance programs that they might be eligible for. Eligibility for patient assistance in this situation is typically much more generous than the eligibility criteria for the government assistance. So more people can qualify for patient assistance through the manufacturers. And typically, if you are approved, it does provide whatever medication that manufacturer makes at little or no cost for the rest of the calendar year. You may have to reapply every year, but it can still save lots and lots of money if you qualify. Any questions about any of that? None at all. Okay. So choosing the right Part D plan for yourself can be kind of daunting. Again, there are 26, 27 plans available in the state of Colorado alone. The reason there are that many plans available is because Medicare Part D works very similar to Medicare Advantage plans in that the government contracts directly with these insurance companies to act on Medicare's behalf. So when you enroll in a Part D plan with an insurance company, and there are multiple companies selling Part D right now, when you enroll in a plan through that company, that is your Medicare Part D. That company is acting on Medicare's behalf to provide the drug coverage for you. That is why you will typically have to pay a monthly premium, and the formularies will vary like I talked about. So some of the basic things to take into consideration before enrolling in a Part D are going to be, of course, cost. That's typically going to be the most important consideration for most people. So you're going to want to consider the premiums for the plans that you're looking at. You're going to want to make sure that the plans that you're looking at cover, again, your very specific medications. You're going to want to look at the copays for those medications through those plans and the deductibles for those medications through those plans. Some of the plans may pay that deductible, so you don't have to pay it at the pharmacy. Some plans do not. Again, some plans may offer zero copay or $1 or $2 copay generic drugs. Some plans do not. So there are a lot of different variables with each plan that may determine what your specific cost would be if you enrolled in that plan. Trying to figure out which one of those plans is going to save you the most money on your drug costs from year to year can be a little difficult and confusing. Your options for doing that would be, of course, you can call each and every plan and ask them if they cover all your medications at what copays, what premium, etc., and add all of that up and see how that's going to work for you, which would be, of course, time consuming and probably a little frustrating. You can contact an agent or a broker to help you through that process. The advantage of a broker would be that a broker is likely to be able to look at multiple plans for you and provide you with just a summary of different plans and what their costs would be at the end of a search. So they would do all the work for you and just present you with the options at the end. An agent is typically going to be dedicated to a specific insurance company and may only be able to provide you with information about the company that agent works for and the plan that they offer. Or the most effective method of trying to determine which Part D plan is going to serve you best and provide you the best deal would be to use the plan finder on the Medicare.gov website. The plan finder is basically a search engine on the Medicare website. This search engine actually allows you to add all of the medications that you specifically take down to quantities and dosages. It allows you to choose up to 5 pharmacy preferences to compare. And the end result is it will take all of that information, go through all the plans, and the end result is it will list all the plans in order of the plan that would save you the most money on that combination of medications and preferences at the top of the list to the plan that would cost you the most money on those preferences at the bottom of the list. So basically the plan finder, the search engine, will do all the math for you and tell you which Part D plans will save you the most money and give you the best coverage from year to year. The best way to access that plan finder would be to create a My Medicare account. Again, a My Medicare account is not required by anybody for any purpose. There are benefits to having a My Medicare account, such as it allows you to save your list of medications from year to year. It can search and compare your options without having to retype all of that information. It keeps a history of the plans that you've been enrolled in. It provides other benefits such as electronic health records, stuff like that. So there are a lot of advantages to creating a My Medicare account, but again, it's not required and it's not needed to use the plan finder. The plan finder can be found quite simply from the homepage of Medicare by simply clicking on the button that says Find Health and Drug Plans. And that will lead you into the start of the plan finder, where you simply start typing in all of your medications. It will ask you for dosages and quantities. It will ask you your pharmacy preferences. It's pretty user-friendly, but if anybody was interested in getting some assistance going through that plan finder, or would be interested in getting more information on how to use the Plan Finder, just as a quick FYI, I will be doing a lunch and learn, I think in September. That will be a tutorial on how to use the Plan Finder. Otherwise, you'd be welcome to contact our office and talk to any of our SHIP counselors who would be happy to help you through that process if you need to look at that information sooner than September. Again, you don't need an account to use the Plan Finder. So once you hit that Find Health and Drug Plans button, it takes you to the next page where you can either log in if you have an account, or under that it says continue without logging in, where you can go through that whole process without having an account. This is the most effective way to find the best Part D plan or even Medicare Advantage plan for yourself from year to year. Simply because this Plan Finder does all the work, does all the math, and ultimately the end result is going to be sorted by total out-of-pocket cost estimates, meaning it's going to add up all your premiums, it's going to add up your deductibles and all your copays and all the different stages of coverage for the rest of the calendar year or the whole calendar year, depending on when you use it. And that end result is going to be based on that total estimated out-of-pocket cost for the year. So again, it's going to do all the math and all the work for you. And you simply need to look at the plans that it outlines at the end. Again, we're happy to help with that process or help walk you through that process. Another option that you can look at is this publication that is put out by the Division of Insurance up in Denver each year. The Division of Insurance puts out this publication for open enrollment specifically, and it details all of the plans that are available in Colorado for the next calendar year. So it gives you a list of all the Part D plans, their premiums, and whether or not there's a deductible, gives you copay ranges, gives you some basic general information, as well as Advantage plans. Same thing, gives you premiums, deductibles, copays, that kind of stuff. It does not give you any more specific information than that, but it can give you a place to start. And I believe I did include this in the email that I sent earlier today that it had these handouts in it. The other way you can get that basic information, again, is going to be the Medicare New Handbook, which you can either access at Medicare.gov in PDF form, or it's preferable that you call 1-800-MEDICARE and ask them to mail you a Colorado-specific handbook, because in the back of the Colorado-specific handbook, it will list all of those plans for Part D and Advantage plans for the state of Colorado. Again, it'll give you the same basic information, general premium costs, copays, deductibles, that kind of stuff. Other resources obviously are going to be Medicare.gov, and of course you can call 1-800-MEDICARE at any time. They're available 24 hours a day, 7 days a week, 365 days a year. Because remember, there is no brick and mortar location for Medicare. You can only reach them by calling the toll-free number or get information from their website or contact your local SHIP office for any questions that you may have related to Medicare. So that is pretty much it on Part D. Does anyone have any questions?
I do. I have another question.
Sure.
If you decide you want to change from one Part D to the other, can you be turned down like you can with the supplement plans?
Absolutely not. Because again, both Medicare Part D and Medicare Advantage plans have the annual open enrollment period. And during that October 15th through December 7th enrollment window each year, you can get into, get out of, or switch from one Part D or Advantage plan to another without restriction or limit. These plans can never underwrite, they can never turn you down. And in many cases, it's to your advantage, especially if you have a standalone Part D that's not part of an Advantage plan. It's to your advantage to use that annual enrollment window to make sure that you're in the most cost-effective Part D plan from year to year, because plans can change and fluctuate in what they cover, what drugs they cover each year, what their premiums will be, what their copays will be. All of those things can change from year to year and may not be as effective for you from one year to the next.
Okay, so if you're switching from one Plan C to another Plan C, they can't have underwriting. It's only if you're switching back to original Medicare, and the same with the Part D?
Correct. So Advantage plans cannot underwrite, and you can go from one plan to another without any restrictions or their ability to refuse coverage at all during that open enrollment period.
Okay.
Other time you might have an enrollment window to take advantage of. So they never underwrite, they can never turn you down. That is correct.
What are the circumstances when they can turn you down? Remember last week you mentioned that.
So the only time a Advantage plan can turn you down is if you're trying to enroll outside of an enrollment window of some sort.
Oh, okay. Okay.
That's
Thank you.
pretty much it.
Okay, thank you.
Hello.
Hello.
I'm just curious about Plan D as compared to all these things that you hear about, like Good RX, and how does that compare to Plan D stuff?
So programs or cards like GoodRx or apps, however you use them, and there are several of them out there. I'm most familiar with GoodRx. GoodRx and similar type discount programs do not work with Medicare Part D, but you can use them instead of Medicare Part D if there is an advantage for you to do that. You can use them instead of Part D, but they are not considered credible drug coverage because they're not coverage through discount programs. But in some cases, they may be more cost effective for some things. Or there may be some things that the plan does not cover under Part D that you could use those discount programs for. But they do not coordinate with one another. They do not play with one another in any way, shape, or form. So you can't use them at the same time. So you can't get your Part D covered drug at a copay and then use a GoodRx discount to reduce that copay. You can't do it that way, but you can use one or the other if you choose to do so.
Okay, thank you.
And then I think I answered the question in the chat box is, can you switch plans during the once a year window? And that is yes. And again, if you are on a standalone Part D plan because you opted for a Medigap, original Medicare and a Medigap, you have to get Part D as a standalone plan separately. And it is to your advantage to take advantage of that annual enrollment window, open enrollment, to make sure that the Part D plan that you're on this year is as cost effective for you next year. And if there's a plan out there for next year that's more cost effective than staying on the plan you're on, it takes literally 2 minutes to make that switch and make a new enrollment into a new plan. Honestly, if you're going to do that, the best way to do that is through the Medicare.gov plan finder, because it literally takes a couple of clicks to make that enrollment happen. When you are changing from one plan to another, whether it's your Part D plan or Advantage plan, under any circumstance, the best way to do that is to simply enroll in another plan. What you don't want to do is call the plan you're in and say, disenroll me, and then go enroll in a new plan. The way Medicare has set this process up is, if you're enrolling during an enrollment window of any kind, you simply enroll in the new plan, and the assumption is that you have a right to enroll in this plan based on your enrollment window. So Medicare will automatically get you out of the other plan and get you into the new plan. So just keep that in mind. You don't want to contact your current plan and say, get me out. All you really need to worry about is finding a new plan and enrolling in that plan for the next enrollment season. Any other questions?
Yeah, I have one more, sorry.
Sure.
So it's only the Medigap plans that you aren't guaranteed you can switch back and forth between.
Correct. Medigap plans are the only option that would be allowed to underwrite outside of their guarantee window or their open enrollment window. That's 6
great.
guarantee issue.
Okay, thank you.
But you can't. IRMAA, I have a question for you, and this is in regards to tier drugs.
Okay.
On chart 1 has a number 4 in the lower left-hand corner, Colorado Medicare standalone RX plans, and it said tiered copays and it said not available. So my question is, I've had Medicare Part D insurances for about 6 years, and I've had some tier 4 medications, and I can understand tier 1 and tier 2 and copays and the relationship there, but I don't understand anything like tier. I don't know if there's anything higher than a tier 4, and I just wanted to try to get some helpful information about
Okay.
how that's figured out.
Okay. So unfortunately, that is a topic that gets a little more confusing every year. When Part D first started, there were 2 tiers, generic and brand name. It didn't take the plans long to start developing additional levels of tiers. So before you knew it, there were 4 tiers. There was preferred generic and non-preferred generic, preferred brand name and non-preferred brand name. And then the next tier, tier 5, is a specialty drug, meaning it's a very specific drug, usually very expensive to treat a very specific medical condition. At this point, I think the last I checked, there are now 6 tiers. So there are now probably 2 types of specialty, or 2 levels, tiering levels of specialty drug. The tier process is something that the government has allowed these plans to develop. I'm going to say to control costs. You don't have to believe me on that. Each tier is going to have a different max cost. So if you are taking a tier 1 generic, meaning it's going to be a drug that's been around for a really long time, it's very inexpensive, it costs the plan almost nothing to provide to you, that's going to be your tier 1 generic. You're going to pay $0 or $1 copay at the pharmacy or less. Tier 2 generics, that is probably the tier that has confused me the most. A tier 2 generic is probably a drug that has been brand name and just recently became generic. When drugs went from brand name to generic in the past, typically the cost dropped dramatically when that happened. Unfortunately, that is not what happens so much these days. And so when a brand name drug goes generic, that doesn't necessarily mean the cost drops dramatically like it used to. And that drug cost can still be pretty high, even if it's a generic. So they're going to be considered non-preferred because they're still supposedly costing the plan more money. So they're going to pass that cost on to you in the form of higher copay. When you start getting into the highest tiers, the specialty drugs, again, those are going to be the most expensive medications to treat some of the most expensive medical needs. MS drugs are going to be a tier 5. Anything that's, again, on the market, you still see a commercial on TV for it to treat like Crohn's disease or stuff like that. Very specific medical conditions, very expensive medications. The plans are allowed to tier them at that higher level because it costs them more money. They're going to pass that cost on to you. And that's when you start looking at the highest out-of-pocket cost at the pharmacy. Tier 5 and 6 drugs are typically going to cost you anywhere from 25% to 75% of the retail cost at the pharmacy based on that tiering situation. There is not really much more to it than that. There's not much more rhyme or reason to it than that. Unfortunately, again, it comes down to the preference of the plan specifically as to how they want to tier a drug. Different plans may tier the same drug in different ways. And I see that happen quite a bit, especially these days with the brand names that may have been around for a while, or even brand or generic drugs that have recently come off being a brand name. Some plans tier them at 2, some plans tier them at 4. It really is dependent on the plan itself. Again, that would be one of the advantages of using the plan finder, because the plan finder actually gives you that information. it tells you what each plan tiers every medication at, and shows you the cost for that plan's drug at that tier level. So again, that plan finder does all the work for you. It is the most amazing tool that I think the government has ever created that I can think of. And it is probably the only way to get the most effective information about the plan that's going to be most cost effective for you year to year. So hopefully that kind of answers your question. Probably not what you wanted to hear, but that's the best I got on that.
Roma, could you address, this is Pamela, could you address when the, I'm trying to think of how to put this. You just explained it earlier about when you're enrolling in a new drug plan, you want to enroll in the new drug plan. You don't want to go back to the old one and disenroll in that and then enroll in a new plan. Why?
No.
Why is that? Or what happens if you do that?
So the way the Medicare rules are set up is that during an enrollment period, beneficiaries are allowed to make one change in plan. And Medicare would consider it 2 changes if you contacted your current plan and disenrolled and then contacted a new plan to enroll. That would be considered 2 changes. That's why Medicare has set up the system so that you don't need to contact the current plan to disenroll. They'll do that for you. All you have to worry about is finding a new plan to enroll in and enrolling.
Thank you.
Again, I will be doing a plan finder tutorial in September at a Lunch and Learn. It will be a Zoom presentation through the library at noon. You can go to our website if you want to get the specific date for that and register for it. It's again in September. I forget the exact date, honestly. And it will be an hour long starting at noon. Or you're welcome to contact us at any time and speak to any of our counselors. We're happy to help you go through the plan finder if you need to find this coverage sooner than that. Any other questions? Again, our office is also the S&P for our service area, which is a program that's designed to help educate and empower beneficiaries if they suspect fraud or abuse of their Medicare and Medicaid benefits. I provided our statewide toll-free hotline, but you're also always welcome to call our office, and we're happy to help if you have any questions or concerns about bills, claims, coverage, anything like that. And we're always looking for volunteers for both of our programs. Here's our contact information again. Don't forget, we do have 5 full-time counselors and a couple of part-time volunteers, all fully trained and certified by both Medicare and the state of Colorado to provide this assistance to you. You can email me with any questions at the email provided, seniorinsure@ppacg.org. You can call our local Colorado Springs office number, or you can call the toll-free statewide number, and it will route you to the SHIP office closest to where you're calling from. Please don't forget about the survey that will be in the email that Jessica sends out tomorrow as a follow-up. It will include a link to that survey as well as a link to a recording of this presentation. I'm going to encourage you to take the survey. Those survey responses do go directly to the Office of Administration for Community Living, and those results do directly correlate with the funding for this program nationwide. So we do appreciate any and all responses you're willing to provide. Other than that, I think I am done. Again, if you have any other last minute questions, please feel free to speak up.
I think the Lunch and Learn talking about September 9th,
September 9th.
I believe. Yeah, the Lunch and Learn.
And it will be at noon, and you can register for it at our website, just the same way you registered for this presentation. It will be the same kind of presentation through Zoom, and it will be at noon. It's a lunchtime presentation. Well, if there are no other questions or concerns, again, I thank you very much for joining us tonight. I appreciate your attendance. Hopefully I will see you all next week for part 4 of our series, where we talk about employer coverage, Medicaid coverage, all the other kinds of options available outside of the things we've talked about so far. So we're going to kind of wrap it up. You're all very welcome. Thanks for the appreciation. And I wish you a good night. Stay cool. And I'll see you next week.
Thank you.